I was fascinated by Tamsin's talk, actually. And I think the thing that came through to me was the need to look after ourselves. And it is a very difficult time for all sorts of reasons. But when we look at the Nursing and Midwifery Code, there is actually a clause in there which states that we have a duty to ensure that we look after ourselves and the safety of others in our care. And, you know, that I think is partly what Tamsin was saying there, but it's also very dear to my heart when we look at things like aromatherapy. As some of you will know, I've been using complementary therapies for a very long time, and I'm qualified in a range of therapies. I do more teaching on aromatherapy than most other therapies, although my personal preferred therapy is a form of reflexology called reflex zone therapy, and I am trained in a range of others. But when we look at complementary medicine or complementary therapies, I think it's very easy to think that it's one thing. It isn't. It's actually a whole range of many, many, many different complementary therapies, each of which has its own mechanism of action, indications, contraindications, and so on, and evidence base, of course. And aromatherapy is by far the most popular therapy at the moment amongst expectant and birthing parents, and increasingly amongst midwives. You know, I do think there is an absolute joy in being able to use aromatherapy. It certainly has a lot of advantages for the people for whom we care. I'm not convinced that we ought to be calling it aromatherapy because, of course, most midwives are not fully qualified aromatherapists. And even if you are, sometimes it can be difficult to apply the principles of aromatherapy to the way in which you use it within your standard midwifery care. We are still midwives and we're still registrants whichever country we work in. But there is definitely a place for bringing in essential oils and massage, i.e. aromatherapy. Now, the reason, I'm just going to screen share, but the reason I think that we decided that it would be useful for me to chat today is because of midwifery aromatherapy in the press. And sadly, only fairly recently, we have had two major newspapers in the UK, first the Times and then the Daily Mail, describing our use of aromatherapy in midwifery as a quack therapy. If you want to see the response that I sent to the Daily Mail, if you go to the Expectancy website, you will find it on my blog, because whilst the Times was relatively generous in the way that they discussed it, the Daily Mail most certainly was not. It was an article that was full of errors, factual errors, full of biased attitudes, and really quite shocking. However, I have to say that whilst I cannot comment on the Nottingham University's situation because it is under review with the Ockenden team moving from Telford to Nottingham, I do have to say that I have some grave concerns about midwives' use of aromatherapy in general. And in no way am I casting aspersions about any particular units. But I think what happens with midwives is that we're so excited and enthusiastic about bringing in something that is wonderful for the parents for whom we care, that it's quite easy to deviate from the parameters that we're allowed to work within, and then to sort of think, oh, well, we'll just do that, or we'll just do that, or we'll just do that. Now, for those of you who may be less familiar with aromatherapy, it involves the use of plant essential oils. They are oils extracted from plants, and each oil contains up to 300 chemicals which have physiological effects. And those may be very positive, or they may be not so positive. And many essential oils are very relaxing, whilst others are stimulating. Some will raise the blood pressure, which we would not want. Others will reduce the blood pressure. Many of them are pain relieving. They actually contain chemicals which have been shown to be analgesic. And all these chemicals have lots of different ways of impacting on the physical body, but also on the emotional side of the care that we're providing. So when you either inhale an oil or you have that oil in contact with the skin, whichever way they are administered, the essential oil chemicals are absorbed into the body. They go around the entire systemic circulation, including crossing to the placenta. And when you inhale them as well, they not only go down into the lungs and the circulation, but they will pass via the olfactory system up to the limbic system in the brain, where they will impact on mood and memory and various other psychological and emotional issues. So I think it's important that we understand what's actually happening with aromatherapy. There is definitely a place for it. Please, I'm not saying anything negative today. I am actually trying to discuss aromatherapy in a way that will help you to take forward your practice if you're already using aromatherapy, maybe to consider using aromatherapy with the appropriate training if you are not yet using it, and also to be able to advise parents on the safe use of aromatherapy. I think one of the problems for us is that because aromatherapy involves lovely massage, which can be very relaxing, and nice fragrances, people think that that's all it is, but in actual fact, it's not. The chemicals act in exactly the same way as medicines, as drugs. They are absorbed, metabolized, and excreted in exactly the same way as drugs. They're all metabolized via the liver, and they're excreted either in the breath or via the skin in the sweat, or via the urine, and to a lesser extent via the bowels. But when we use aromatherapy or essential oils in midwifery, it's really important that it's not just something that is done for everybody. You cannot have essential oils available in a standard dose and a standard blend of different aromas for everybody. It's got to be individualized. So really, what we're saying is aromatherapy needs to be viewed as a clinical intervention. Yes, we want to enhance the birth environment. We want to help parents relax and prepare for birth or recover from the labor, but we have to use it within the parameters that are part of our midwifery practice. Even if you're a fully qualified aromatherapist, when you're using essential oils and massage as a midwife in your midwifery practice, you're using it as a midwife. And therefore, we have to use the oils and the techniques for administration within the parameters in the UK of our Nursing and Midwifery Council registration, or if you're in another country, within the parameters set by your national regulatory body. We also have to take into account regulations from our employers. We have to have indemnity insurance. We know that for our practice anyway. With aromatherapy, as opposed to other complementary therapies, we have to look at the principles of medicines law. Interestingly, you can't, they're not able to be put onto the prescription sheets because they're not substances which are in the British National Formulary as a medicine, apart that is from peppermint oil. But everything else is not officially a medicine. They've not been tested in the same way as drugs. However, we have to adhere to the basic principles of medicines regulations, which state you use the right substance at the right time for the right person in the right dose, the right frequency, the right method of administration, the sort of rules and regulations we apply to drugs. In addition to that, we have health and safety at work, and the control of substances hazardous to health regulations, which basically mean that we are required, both as employees and employers or managers, we're required to ensure that whatever is done is safe, not only for the patients or the people in our care, but for the people working with those substances. And that doesn't only mean ourselves, it means everybody else who's exposed to aromatherapy oils, including portering staff, domestic staff, everybody who comes through the area in which we are working and using aromatherapy. And then since 2020, there's been a slight change in what organisations regulate aromatherapy. Now, prior to Brexit, the European Union had various directives related to herbal medicine, which includes aromatherapy. But since Brexit, most aromatherapy practice, as opposed to the production of oils, for example, but the actual clinical practice is regulated largely by the cosmetics regulations. The reason it's under the cosmetics regulations is because they're not drugs, and therefore they've got to sit somewhere, but it can be a little bit difficult because they're not cosmetics either. So people are sort of not quite sure what exactly regulates aromatherapy. Now, when it comes to our use of aromatherapy or essential oils within our midwifery practice, because it's something new, and for some people it's something a bit odd, it's one of these alternative therapies that can be readily dismissed, and there is less evidence overtly available. I'm not saying there's no evidence, but it's less readily available. We have to justify our use of complementary therapies, including aromatherapy, twice over, really. And there is still a lot of skepticism about using these so-called alternatives. I don't use that term, actually. I think that anything that we use that is outside mainstream healthcare in pregnancy, birth, and postnatal has to be complementary to standard maternity care, whether that is provided by midwives or doctors or doulas or anybody else. However, I would say there is a need to be ultra cautious. And therefore, as a general rule, I would say that aromatherapy should really only be offered for pregnant, birthing, or postnatal parents who have no diagnosed complications. And that means that they will be outpatients, not admitted to the antenatal ward with a complication. They can be used within a low-risk midwife-led birthing centre, but generally should not be used on the main delivery suite, where there are, by definition, people with complications, as with antenatal inpatients. Now, that's not to say that you can't use aromatherapy for everybody on the delivery suite, because, of course, occasionally you'll have women who have gone to delivery suite because they're not eligible to go to the birthing centre, but whose pregnancies have gone through, they've progressed normally, and the birth is actually progressing relatively normally. It's those people with complications, any deviations from normality. Similarly, even in a midwife-led birthing centre, it's really important to discontinue essential oil use at the beginning of the second stage, or preferably, if you know when it is, at the start of the transition stage. And the reason for that is that essential oils should never, ever be used on or near neonates, newborn babies, up to about the age of 3 months, I would say, actually. And there are several really important physiological reasons for this. One is that the baby's skin is very sensitive, therefore you would not want to be putting these chemicals on the skin. The second is that babies in part recognize their own mothers through the sense of smell, and the oil vapors and the aromas may mask that. The other three reasons are really important. One is that the baby's liver is immature. We know that. It's busy metabolizing fetal hemoglobin, and it's not able to cope with additional metabolic requirements for the excretion of the waste products from essential oils. Similarly, the blood-brain barrier is underdeveloped, and a baby that inhales essential oil vapors, the aromas, some of the chemicals can be toxic, and because they pass rapidly across the baby's blood-brain barrier, that can cause an increased risk of cerebral irritation. With the liver issue, there is an increased risk of jaundice becoming kernicterus and that sort of thing. And then the last issue is to do with the baby's immune system. All essential oils are antibacterial to a greater or lesser extent. Some are antiviral, some are antifungal, kills all known germs sort of thing. But the baby's immune system is immature. Now, if you expose a newborn baby whose immunoglobulins have not fully developed, so under sort of 6 to 8 weeks, if you expose them to the anti-infective properties of essential oils, you may impair the maturation of the baby's immune system, which potentially risks that baby growing into an adult who is less capable of fighting infection. So one small amount of essential oils at birth is not going to cause a problem, but we do need to be absolutely careful at every stage that the oils are not used on babies, and where possible they're not used near babies, which is why I'm saying it's better to discontinue the use of essential oils by the second stage of labor, so the baby's not born into an atmosphere with essential oil vapors. Similarly, you don't put them into a birthing pool. You would not want that baby's skin to come into contact with water that has had the essential oils in. This message I want to get across to you more than anything else. And if you can smell the aromas, if you can smell the smells, the fragrances, however pleasant they are, when you smell them, you are inhaling chemicals. Every single person in the room where essential oils aromatherapy is being used is exposed to the chemicals within the oils. They will then pass through to our systemic circulation. What that means is that when you are using aromatherapy, by whatever method, even if you're just massaging it onto a birthing woman's skin or whatever, the chemicals in the air affect all people in the room. That's the parents, the babies, and all staff exposed to the aromas. And it is possible that some essential oils can be contraindicated for staff with particular medical conditions. If they're on any medication, there is always a risk of drug-oil interactions. If they have active epilepsy for which they require medication, then they should in no way be exposed to these essential oils. If they've got high blood pressure and they're taking antihypertensives, they don't want to be exposed either to oils which increase the blood pressure, which we tend not to use in midwifery, but neither do they want to be exposed to oils that reduce the blood pressure because it can potentiate the action of the antihypertensives. And most importantly, particularly when oils are being used in the birth centre, midwives who are pregnant or trying to get pregnant or going through infertility treatment or anything like that should not be exposed to the chemicals from oils which are designed to aid labour progress. And I have had quite a few midwives who have contacted me and said, look, I'm working in the birthing centre and we have essential oils, but actually I'm in early pregnancy. I don't really want to tell anybody. I did once have a poor midwife who was in tears on the phone, who said that her manager had refused to move her from the birthing centre, even though the midwife had admitted that she was in the first trimester of pregnancy. And I think this was because the manager didn't understand the impact of the oils and the chemicals. We need to think of aromatherapy vapors in exactly the same way as when we are exposed to chemicals from cigarettes or other things. It's like passive smoking. Yes, you might be able to see the smoke of a cigarette, and no, you can't see the vapors of the oils. But if you are inhaling them, you are inhaling chemicals. And this means that it is absolutely, completely contraindicated for diffusers or vaporizers to be used in a birth center or a maternity unit. It is something that is often used to fragrance the atmosphere. And it can be very pleasant, but it is just not safe within the birthing environment. If you visit a woman at home, a family at home, and they've got, one on in the home, that's their prerogative. However, my advice would be that you suggest to them that they only leave it on for 15 minutes and then turn it off for the rest of the hour. You can't stop them using the vaporizers at home. But I think when it is on our premises in the NHS or other maternity unit, it's really unsafe. It's quite unethical, actually, to be using diffusers, which the vapors and the chemicals from the oils may adversely affect people in ways that you cannot anticipate. I'm actually allergic to geranium oil and increasingly to rose oil, because geranium and rose share some of the same chemicals. And if you think about somebody, you might know somebody who's got a sort of shellfish allergy or something like that. So when they first start developing this allergy, they may get, just a little bit of nausea. And then next time they get a bit of sickness. And then next time they get a bit of diarrhea and sickness. And eventually, if they don't recognize it and they continue to be exposed to the allergens from the shellfish, they can have an anaphylactic shock. And that can be fatal, And the same thing applies to the chemicals in the essential oils. Now, I'm not trying to worry you, but I am trying to make you understand that actually the way that we are currently using essential oils in many maternity units is actually not only contravening health and safety at work and control of substances hazardous to health, it's actually really unethical, because people might not like the aromas, they might be allergic to them, or they may be seriously, affected by one or more chemicals. And it's a difficult situation, because I think midwives get very excited about the essential oils and using them and making the room smell nice and providing a nice birthing environment. But actually, you do have to be extra, extra cautious. I just want to finish on Clary Sage. Now, Clary Sage is probably the most well-known oil apart from lavender. It is definitely one that is very, very popular amongst expectant parents. It's also one that's frequently used when midwives have set up aromatherapy services in the birthing centre. And it can be a very, very nice oil. It's a bit medicinal in the smell, but if you blend it with other oils, it's okay. And it can be really effective. Clary Sage reduces the blood pressure, and it has some antidepressant effects, and it's got some pain-relieving chemicals in it. But it is definitely an oil which should never be used in pregnancy until term. So you would never use Clary Sage until 37 weeks of pregnancy minimum. And neither should you use it when labour is well established. And when I'm teaching my courses, I always say to the midwives, think of Clary Sage as nature's syntocinon, not oxytocin, not natural oxytocin, but nature's syntocinon or pitocin. If you are thinking that it's nearly time to get somebody to set up some syntocinon because things have deviated from normal, then maybe that is a place to use Clary Sage oil prior to see if it works. But if labour is well established, no way would you want to put up Syntocin on, because the woman's body is doing its own job and it's working efficiently. If you use Clary Sage in well-established labour or when it's inappropriate, initially you can find that the woman will develop hypertonic uterine action, so the contractions will get stronger and longer and possibly more frequent. And that in itself may lead to fetal distress. And that's a very common picture that we are seeing around some of the units. However, what is also happening is something called hyperpolarization. Now, hyperpolarization means that whenever you have a drug, you need a period of time before that drug kicks in and starts to work and be effective to do the job that you've prescribed it for. So here we have, sorry, Sue, can you see my cursor along the line? Yeah, okay. Here we have the point of administration of a drug. And gradually, as the amount of drug in the bloodstream increases, it starts to work. It starts to do its job. But if you use a drug inappropriately, over too much, too often, too high a dose or whatever, eventually it gets to the stage where it increases its activity. And that's what happens with Clary Sage. So here is the normal use of Clary Sage. Here is some prolonged use of Clary Sage, and this is where we get the excessively strong, excessively frequent contractions of the uterus. Now, if you continue using it and you haven't recognized that Clary Sage is beginning to cause excessive contractions and fetal distress, what then happens is the bloodstream level goes over the edge and starts changing to the point where the effect of the drug or the oil diminishes until eventually, in the case of Clary Sage and contractions, the contractions peter out and the labour stops. And I can tell you the case of one woman who was in the birth centre. She'd brought in her own essential oils, including Clary Sage, and she was labouring well. She was using Clary Sage and she was being cared for by midwives who didn't use aromatherapy, and the midwife she was working with was, unaware of aromatherapy really. And then it got to the stage where she started to have some excessively strong contractions, and the CTG monitor showed that there was the development of fetal distress. And nothing happened. It wasn't bad enough to transfer her over to delivery suite. So everything was fine. The woman continued using the Clary Sage, and then the contractions started to peter out. They slowed down and eventually they tailed off. So she was transferred over to delivery suite where there was no aromatherapy. And after about an hour, the contractions came back, and they came back with a vengeance, and she got back into what appeared to be well-established labour. And so they said, we don't need to keep you in delivery suite. We'll take you back to the birth centre. It's co-aligned, but it's still a transfer across the corridor. And she went back into the room that she'd had before and started to use her Clary Sage again. And this time, the hypertonic action element was very, very short, and then the contractions stopped. So they took her back to delivery suite. Poor family was being carted backwards and forwards. Eventually, she ended up with an emergency cesarean, and everything was fine. But the situation arose because the parents didn't understand about the overuse of this oil, and it happens with other oils too, but Clary Sage is the main culprit. And the midwives caring for her didn't understand it either. So my message to you this evening is we have to use aromatherapy as a clinical intervention. That means we have to know how it works, what is the correct way of using it, what to look out for in terms of side effects or complications. And think about it for the individual. It isn't appropriate for everybody. So what can we do for this individual parent? And look at the essential oils as drugs. Remember that if you are inhaling the vapors, the smells, you are also exposed to those chemicals, and they may affect you as much as anybody else. And Clary Sage is notorious for increasing menstrual blood flow when midwives are menstruating. It causes menorrhagia. Yeah. And I think my watchword is, you need to know what you're doing. I am sorry to say that there are a few midwives around the country who love doing aromatherapy, and they love doing the massage and using the oils, but they've stretched their boundaries a little too much. And actually, we need to be cautious, particularly when this is something which is not necessarily a mainstream part of midwifery practice.